Hi, my name is Jennifer Slough, and I'm one of the instructors with the Physical Therapist Assistant program here at San Juan College. And today I want to share a presentation with you that talks to you a little bit about our program, what it is to be a physical therapist assistant, and physical therapy in general. What is physical therapy? A lot of people don't actually know what we do. We provide treatment, and it's either from a physical therapist or a PT, or a physical therapist assistant, a PTA, that helps people improve their movement and physical function by managing pain, chronic conditions, surgical conditions, something simple like an ankle sprain, the works. We cover it all. So what specifically is a physical therapist? They're evaluation experts that are licensed doctors. So if you become a PT, you graduate with a doctorate of physical therapy, and you can treat and examine, diagnose. So if you think about going to your doctor for an illness, you go in, you have a runny nose, you're sick, they go through tests, they diagnose you with the flu or whatever it may be, and you get treatment. A PT is very similar, but they're diagnosing joint problems, muscle problems, bone problems, things like that. Now, while they do provide some of the treatments, it's the PTA that does the majority of the treatments. So after you get through our program, you become a licensed clinician. There is a licensure exam at the end of it, but that license transfers through the whole United States, and it covers the entire spectrum of physical therapy. So we use evidence-based treatments such as therapeutic exercise, manual techniques, meaning hands-on techniques. That may include something as simple as massage or stretching a patient ourselves, something like that. And we provide a lot of patient education. We also help the PT by gathering some of that data. So the information that they gathered in that initial treatment to decide what was going on, we may help do a follow-up and give them that information so that if changes need to happen, those things can occur. There's also physical therapy aides that you may have heard of, or physical therapy techs or technicians. They are not a licensed field, and basically they're there to help keep the clinics running. So in essence, the PTs develop an activity plan and say, this person has this wrong with their knee, and the PTA implements that activity and works with the patient from start to finish to get improvement. So 7 things you didn't know about physical therapy. Number 1, only licensed PTAs and PTs can provide true physical therapy services. So we get confused with a lot of other fields. The first one is a personal trainer. If you want to look like The Rock, go to a personal trainer. If you get injured trying to look like The Rock, you come see us. That's the difference, okay? Healthy people who want to improve their body is a personal trainer. Injuries are when you go see a PTA or a PT. We're not massage therapists, but we do kind of get into massage therapy a little bit. We provide different massages, but it's very specific to a body part. So if you go have a massage done, and maybe you've had one, you got a full body massage with like a Swedish technique or a hot stone massage, what we do is we're gonna isolate it to one area like the hip or the neck. We're only working that area, and it's specific to muscle issues. Athletic trainers are very different than physical therapy, although a lot of PTs and PTAs have dual certifications. So the athletic trainer, if you watch sports, is the first one out on the field when an athlete gets injured. And they also work closely with different athletes or programs or companies that try to keep them healthy and keep them in a certain amount of training. So after the initial injury has occurred, if you've ever watched sports like football, if they blew out their ACL, athletic trainer is going to be the first one on the field, and then after they've been through the athletic trainer and the doctor, then the PT and PTA is going to take over. Now again, you can get a dual certification, and we have a lot of students that have gone on to do that if you're interested in working in sports medicine. We're also not chiropractors, but this is another area that there are clinics that exist that work side by side with a chiropractor. So what is a chiropractor? Oftentimes chiropractors focus mainly on the spine, and they do manual manipulations. So if you've ever been to one, they put you in weird positions and pop your back, okay? So there's various techniques for that and various reasons, but a lot of times we may work side by side with a chiropractor so that after they do the manipulation, we're working on the musculature to help hold whatever it is they did. So separate fields, but we work together. What are PTs and PTAs? We're movement and body mechanics experts. We are licensed and evidence-based, and we're trained to treat all populations, including all of these. So PTs and PTAs care for people of all ages and abilities. One of my favorite things about this field is once you graduate from this program, you can work from birth all the way to end of life. Me personally, I have treated as young as 5 years old up to patients in their 90s, and I've had one patient that was 101 years old. So, and everything in between. So whatever your niche may be or whatever your interest may be, there's an area of physical therapy for it. So these are all the areas that you can work in for physical therapy. One of my favorite things about this field as well is the fact that once you get out, you are not siloed into one specific area. You can jump around as many times as you like. So a lot of us work in hospitals and acute care facilities. We go into the patient's room, we might see them right after a surgery or a major injury, or they may be coming down to our treatment facilities and working with us in that aspect. Private practice and outpatient clinics, as a PTA, you can own your own clinic. Outpatient clinics are where the patients come to you and get their therapy session. Nursing homes and assisted living facilities for kind of end-of-life care, we have a huge area of that. Home health. Home health is where you set your own schedule, has a lot of freedom, and you go to the patient's home, treat them there, and then leave. You can work in school systems. So a lot of PTAs and PTs work within the schools for students who have specific disability issues, or if they have some kind of injury that they've been working with, we pull them out of there, work with them throughout the day on something called an IEP, and then send them back to class. Sports and fitness facilities, I personally have had a couple students who have gone to work with the Texas Rangers, which is pretty cool. I've also had some students who worked with Olympic athletes down in Dallas. The clinic name has changed, but at the time it was Michael Johnson Performance, and they actually got to work and be a part of Olympic athleticism and also Nike training products, which was really cool. Corporate offices, military, public health, the sky is the limit. We treat every part of the body. Everyone thinks that we're musculoskeletal and nervous, and yes, that's a huge part of what we treat. Any muscle in the body, we treat it, from TMJ in your jaw, if you have jaw problems, all the way down to a jammed big toe. We treat it all, okay? Nervous system, such as if you've ever had a family member who had a stroke, we help those patients get as much functionality back as possible. Traumatic brain injury, spinal cord injury, if they lose function of their legs, we help those patients get as much of their life back as possible. Things you may not have known about physical therapy are things like cardiovascular and respiratory. So there's a specialized area of physical therapy that if a patient's had a heart attack, had open heart surgery, any of those things, they go through cardiac rehab. And what that does is it's very specialized training, and they start with very low level activities to where we're not stressing the heart too much and get them all the way back up to normal daily activities. Respiratory kind of falls under that with like COPD. If you've ever heard of the terms of emphysema or even asthma, we can help treat those situations and those conditions. An area of physical therapy a lot of people don't know about is that we do wound care. And so that could be burns, it could be diabetic wounds. Some people find that kind of gross, some people find it really, really cool. Just depends on what your preference is. I have personally done wound care. It's really fascinating to watch a wound heal. But it's an entire specialized area of physical therapy. Urinary and reproductive. This is kind of an area that's exploding right now in physical therapy. Women's health. Women or people who have had pregnancy and have had problems, because pregnancy and delivery is a trauma to the body. For the longest time, we didn't focus too much on mom after birth. We just focused on baby, and now we're realizing that if we help the person regain their function, their quality of life is so much better. So this is a big area of physical therapy right now. There's a lot of things you can do within that field. And then just some others: immune system, digestive diseases, all kinds of things. So PTAs can focus on specific areas of care. So we've kind of talked about some of these. Acute care is in the hospital, cardiovascular pulmonary we've already mentioned. Geriatrics is the older population. Oncology being cancer patients. Orthopedics, this is musculoskeletal conditions, things wrong with those muscles and joints. Pediatrics for kids, the wound management, sports, and women's health. What's cool about physical therapy, again, is that you could do all these in your entire career. Nothing says you have to stay in one and stay there. So there's essentially two different pathways for physical therapy. You either go the pathway of the DPT or you go the pathway of the PTA. So how to become a doctorate of physical therapy, high school or GED, or high school diploma or GED, your bachelor's degree. Generally the bachelor's degree takes 4 to 5 years to complete because of all the prerequisites required for DPT school. So you're looking at 4 to 5 years here, another 3 years here, and then you're to the licensure exam. For PTA, and the reason we consider this two pathways is it's high school GED. There are some prerequisites to our program. It takes about a semester or two to complete those, a 2-year associate's degree, and then the licensure exam. So essentially you're looking at 8 or 9 years here versus 2 to 3 years here. Pretty big difference. Starting salary for a PT is around $60,000 to $70,000. Starting salary for a PTA is anywhere between $45,000 and $55,000. So if you think about it from that aspect, how much this costs versus this, we encourage a lot of people to go this route. Now there are PT to PTA bridge programs. I believe right now there are 3 in the United States. The thing is, you have to complete this first, practice for an average of 2 years, and then get all your prerequisites, and then you would basically start here. They are hybrid programs, but you still have to go through clinicals and all those things. So if you're interested in being a physical therapist, it's better to follow this pathway. If you're interested in treating patients and being the PTA, it's better to go this route. So as a PT or PTA, you can be a clinical practitioner, meaning you're out in the clinic working with patients. You can be a board certified specialist in any of the realms. I think there's about 14 of them. A lot of our students are interested in travel physical therapy. So one of my good friends did this when we graduated school. She got out, wanted to see the United States, did it with travel PT. She hired on with a specific company, and she said, I want X, Y, and Z states. She hit both coasts. She went to Hawaii. She was there on average for about 6 to 8 weeks at a time. They paid her room and board. She had a great stipend for utilities, cell phone use, all that stuff. She was able to pay off her schooling in that. Then when her dream job opened, which was working with veterans in a veterans hospital, she transitioned out of travel PT, paid off everything, had saved up enough for a house, still works at that same veterans clinic, loves her job. So kind of a cool opportunity when you graduate out of school to be a travel PT or PTA. You can do what we do. You can be a professor or a program director. There's research opportunities. APTA is our association, American Physical Therapists Association. Entrepreneur, owning your own clinic, sky is the limit. Why choose this field? Movement is essential to life. And with the way things are going with technology and how we kind of are becoming more sedentary, our field is not going anywhere. But it is so wonderful to work with patients who come in who have had severe injuries. I've worked with significant car accidents, significant brain trauma, all these kinds of things. They couldn't walk, they could barely speak, and by the time the therapy is over, they're leaving the clinic, they've resumed daily life, they're back to their families, they're holding grandkids. It's wonderful. And I was a part of that journey from start to finish. It is absolutely incredible. And you see the progress daily. It's fantastic. So physical therapy is personally, professionally, and financially a very rewarding career. We are a top-ranked healthcare profession, and it keeps growing. I think right now it's about 15 to 20% growth a year, which is amazing. So I mentioned earlier in this presentation starting salaries. Median salary for a PT right now is about right at $90,000, and median salary for a PTA is around $60,000. That's pretty amazing for a 2-year degree if you think about it. And again, you can always bridge up, sky's the limit. So foster relationship with your patients. We get close to our patients because we work with them so closely. It's awesome. And again, I mentioned this earlier, but you can see their progress from coming to you in a wheelchair to being able to get up and walk out of the clinic. So this is our last slide. We change lives. These are some of our previous students. This was a kids camp that used to be held at San Juan College. So these kiddos would come with various disabilities. These that are in the green shirts are all of our students, and they worked with those kids and took them through all kinds of fun activities. You can see on this one, they were doing some archery. This particular picture is our students with a gentleman who had a spinal cord injury. He was showing off all of his cool truck accessories because he was still able to fully drive. He just had to have alterations to the truck. Super interesting presentation. This one is a previous student of mine. He's at a specialist clinic that specializes in robotics. This clinic is one of the coolest clinics I've ever seen. They actually had a gamer on site doing virtual reality who would design games to help patients improve function through virtual reality. But this particular piece of equipment helps people relearn how to walk, and so you can see that he's kind of elevated off the treadmill. It lowers down to the treadmill, and it mimics an actual walking pattern. So all kinds of things that you can do. So after this presentation, there's a worksheet available to take you through some balance activities, some things to test your skills. So give that a look, and if you have any questions about our program, please feel free to reach out to Sandra Sorehorse or the Advising Center, and they can provide you with information as well as the sheets that your instructor will be giving out to you. Thank you. Have a great day.